Implant dentistry, from consultation to final restoration. Implant dentistry has transformed dentistry in offering patients a long-lasting alternative to losing teeth. From initial consultation through final restoration, the process of obtaining dental implants could transform the lives of patients who lost several teeth. In this short video, we'll discuss the different stages of dental implant placement and the ways they can aid in the successful implant placement. Consultation. The initial step in the process of obtaining dental implants is to consult with an implant dentist who is certified. In this consultation, the dentist will assess the oral health of the patient and decide if they're the right candidate for dental implants. Things like the patient's bone density, general well-being, and dental hygiene practices are taken into account prior to deciding on the procedure. If a patient is considered to be a good implant candidate, the dentist will develop an individual treatment plan that is based on the individual requirements. It could involve taking X-rays or impressions, as well as photos of the patient's dental and jawbone in order to make sure that implants are at the right position to ensure the best aesthetics and function. Implant placement. After the treatment plan is approved, the next stage is the placement surgically of dental implants. The procedure is usually done under local anesthesia in order to guarantee the patient's safety during the entire procedure. Dental professionals will create an incision into the gum tissue in order to expose the jawbone underneath before drilling a tiny opening for the implant to be inserted. Implants for dental implants are inserted in the jawbone and then allowed to heal over about 3 to 6 months. In this period, the bone is gradually able to join the implant via a process known as osseointegration that provides a solid base for the reconstruction. Final restoration. Once the period of healing is over and the final crown can be put onto the dental implant. It could involve the attachment of a bridge, crown, or denture to the implant in order to restore functionality and appearance to the smile of the patient. The final dental restoration is made to order for a perfect fitting with the natural gums and teeth. Maintenance and care. After the dental implants have been installed, it's crucial for patients to follow excellent oral hygiene practices to prolong the life of the implants. It is important to floss and brush frequently and having regular dental appointments to check the health of the implant and the surrounding tissue. In certain situations, further procedures like gum tissue grafting might be required for the successful completion of the treatment for dental implants. These procedures are able to enhance the general oral health and create a solid foundation that allows implants to flourish. Implant dentistry is a long-lasting treatment for missing teeth and allows patients to bring back function and beauty in their appearance. From initial consultations to the final treatment procedure, getting dental implants requires careful plan and execution in order to guarantee that the procedure is successful. When working with a certified implant dentist and adhering to the correct treatment and maintenance guidelines, patients can reap the advantages of dental implants for a long time to come.